Which outcome measure is scored based on resistance to care, verbal abuse, physical abuse, and socially inappropriate behavior? A. DRS, B. ABS, C. CPS, D. RAIS. The correct answer is B. ABS, Aggressive Behavior Scale. The Aggressive Behavior Scale is an outcome measure calculated using 4 specific inter-RAI-LTCF items: verbal abuse, physical abuse, socially inappropriate or disruptive behavior, and resists care. Each of these behaviors is scored from 0 to 3 based on their frequency, which are then added together to generate a total ABS score ranging from 0 to 12. What score on the depression rating scale, DRS, typically indicates possible depression? A2 plus B3 plus C5 plus D6 to 10 E11 to 14. The correct answer is B3 plus. Based on the provided inter-RAI-LTCF training materials, the depression rating scale, DRS, has a score range from 0 to 14. A score of 3 or more, 3 plus, indicates a potential or actual problem with depression. How many ADL items are used in the long-form ADL scale? A3, B5, C7, D6. The correct answer is C7. Based on the provided inter-RAI-LTCF materials, the activities of daily living, ADL, long-form scale uses exactly 7 ADL items to calculate the residence score. These 7 items are: 1. Personal hygiene, 2. Dressing upper body, 3. Dressing lower body, 4. Locomotion, 5. Toilet use, 6. Bed mobility, 7. Eating. Each of these items contributes up to 4 points, resulting in a maximum possible score of 28 for the long-form ADL scale. Which of the following is not an inter-RAI outcome measure? A. ADL hierarchy, B. Aggressive behavior scale, C. Berg balance scale, D. Chess. The correct answer is C. Berg balance scale. The inter-RAI-LTCF training materials list several specific outcome measures, which include the activities of daily living, ADL, hierarchy scale, the aggressive behavior scale, ABS, and the changes in health, end-stage disease, signs and symptoms, CHESS, scale. The Berg balance scale is not included in the standardized list of inter-RAI outcome measures. A high score on the fracture risk scale suggests A. Low fracture risk, B. High fracture risk, C. Pressure ulcer risk, D. Pain severity. The correct answer is B. High fracture risk. According to the Inter-RAI-LTCF Outcome Measures Guidelines, the Fracture Risk Scale, FRS, is designed to identify a person's risk for hip fractures within 1 year of their assessment. The scale ranges from 1 to 8, and higher scores specifically indicate a higher risk for hip fractures within that time frame. What is the score range of the ADL hierarchy scale? A 0 to 5, B 0 to 6, C 0 to 28, D 0 to 12. The correct answer is B 0 to 6. According to the Inter-RAI-LTCF training materials, the score range for the activities of daily living, ADL, hierarchy scale is 0 to 6. Higher scores on this scale indicate a greater decline or progressive loss in a resident's ADL performance. The fracture risk scale considers past fall history in its calculation. True/false? The correct answer is true. According to the Inter-RAI-LTCF training materials, the fracture risk scale, FRS, uses 9 specific assessment items in its calculation, and one of these items is the resident's past fall history. Specifically, it factors in whether the person has had any falls within the last 180 days, items J1A, J1B, or J1C. The Deaf-Blind Severity Index combines which 2 domains? A. Hearing and mobility, B. Vision and hearing, C. Speech and cognition, D. Vision and cognition. The correct answer is B. Vision and hearing. According to the Inter-RAI-LTCF training materials, the Deaf-Blind Severity Index, DBSI, provides a summary measure of a person's functional vision and hearing. It specifically combines the scores from 2 assessment items, hearing, D3A, and vision, D4A, to evaluate the combined degree of impairment in both senses. The Cognitive Performance Scale, CPS, combines which types of data? A. Only memory recall items, B. Decision-making, continence and communication C. Memory, decision-making, and eating D. Hearing and vision. The correct answer is C. Memory, decision-making, and eating. The Cognitive Performance Scale, CPS, is used to describe the cognitive status of a resident and is calculated by combining 4 specific inter-RAI-LTCF assessment items. These 4 items are: cognitive skills for daily decision-making, item C1, short-term memory OK, item C2A, making self-understood, item D1, eating, item G1J. While option C omits the communication component, making self-understood, it is the most accurate choice because it correctly identifies the other 3 specific data types used in the CPS calculation. In contrast, the other options include irrelevant items such as continence, which is not part of the CPS, or hearing and vision, which are instead combined for the deaf-blind severity index. When combined, these items generate a CPS score ranging from 0 to 6, with higher scores indicating more severe cognitive impairment. The scale has also been validated against established clinical screens like the Mini Mental State Exam, MMSE, and the Test for Severe Impairment, TSI. A CPS score of 0 to 1 indicates intact or borderline intact cognition. True/false. The correct answer is true. According to the Inter-RAI-LTCF training materials, a cognitive performance scale, CPS, score of 0 indicates intact cognition, and a score of 1 indicates borderline intact cognition.